Well, grace and peace to you of our Lord and Savior Jesus Christ. I welcome you to this place as usual. I can't believe it's been 12 weeks. And I hope that everyone has enjoyed their time together. I know we have certainly, I believe, benefited a lot from being here. And this is our last meeting, and we have a special guest with us. This is Ms. Teresa Walsmith. She is a licensed insurance broker and will be speaking with us this morning about Medicare, supplementals, benefits, anything like that. Question and answer. So I think she's going to make a little presentation, but don't be shy, and this group is not.
Good.
Just, speak right up. So I'm glad you're all here. Please feel free to move about, get your coffee and your beverages, and let's go ahead and open with a prayer. Heavenly Father, I just thank you, Lord, for this day. I thank you for the privilege of being here, the ways that you have brought us all together that we may heal both spiritually and physically, Lord, and I pray that the words of our mouth, the meditations of our hearts today would be acceptable to you, O Lord, our strength, our rock, and our redeemer. In Jesus' name, amen.
Amen.
Thank you, Lord. Ms. Walsmith.
Good morning. So yes, my name is Teresa Walsmith. I am a licensed insurance broker and community liaison for Tippy Group Insurance. A little bit about me. I'm a mother of 5 and a grandmother of 8 with one on the way. So yeah, I'm very excited about that. I'm from the Amarillo area originally. That's where I was born and raised, and moved down here 7 years ago. My husband's retired lieutenant for Department of Public Safety. He was over the Criminal Investigation Division. So he came after our last child graduated to complete his career down here. So that's what got us to the Waco area. I never thought I would stay because I loved West Texas and that's where I was from and that's where my family was. But I fell in love with the area and the people, and I took this job and I really enjoy what I do. So that kind of kept us here. So we bought a home, we're staying, and this is our home now. So we live in Hewitt. And very happy to be here. So, but a little bit about what I do. So I work in the community as a community liaison. So I work with churches, food banks, housing authorities. I teach classes about Medicare. And mainly I do all types of insurance, but I specialize in Medicare. That's my heart. That's something I truly love. I worked in hospital administration for 17 years, so I've seen all sides of insurance. I'm a certified coder and biller, so I started out doing that, and so I can see when people are struggling with their insurance trouble that it can cause. So all the way from when you go to your doctor, all the way down to if you get admitted into the hospital. So my job and what I like to do is make sure that whatever insurance you have is what's best for you. So with Medicare, the dirty word Medicare, we know there's so many different ways to get your coverage with Medicare, okay? The red, white, and blue card itself only covers 80%. So my job is to help you cover the 20% coverage gap. There's so many ways you can do that. You see all the commercials on TV. There's all the different companies. I'm appointed with all of them. I contract with all of them. But there's 2 ways that you do that. So the one way you can do that, and I don't know, some of you probably may already have some of this coverage, is what they call a Medicare Advantage or Plan C. Y'all hear that on TV all the time. And what that is that gives you everything in one bucket for your 20%, okay? It'll give you the 20% coverage that the 80% doesn't cover, and then you'll get vision, dental, hearing, gym membership. Sometimes you can get over-the-counter items, depending on your level, different people, different things, different plans pertain. So what I'm telling people when I sit down, I do what is called a needs analysis. What is good for Mary is not good for Betty, okay? Everybody's financial situation is different. Everybody's health situation is different. Everybody takes different medicine. So all of that comes into play when you're looking at what plan is best for you for your coverage, okay? Every plan covers your medicine differently. Some of them don't have medicines in their formulary that aren't covered. So you don't know that till you go to the pharmacy and they say, oh, it's $600, your plan don't cover that this year. So that's my job. As I sit down, we look at who are your doctors, what medicines do you take, and what can you do? I mean, what can you afford? So generally, a Medicare Advantage plan is $0. It doesn't cost anything because you know you're already paying that $202.90 out of your check every month for Part B to have it at all. Medicare is going to charge you that, and it goes up every year. So you know you're paying that. What else do you need so that you get all that coverage that you need? So the other way you can do that is what they call a Medicare supplement or a Plan G. And what that is, it's what I call that is paying for it whether you need it or not. So you're going to pay a monthly premium for that every month. Right now, I'm writing them between $130 and $160 because they went up about 75% 2026. But all that does is give you that 20% coverage gap, okay? You don't get the dental, you don't get the vision. We get you prescription coverage, but that's another plan we have to look at. It's not in the all included, so you have to get something separate for that. But what it does allow is to give you flexibility. With a Plan G or a Medicare supplement, you can go anywhere that accepts Medicare. No referrals, no authorizations. They accept Medicare, you can go. After your $280-something deductible, it's going to pay 100%. But you're going to pay for that. That's what I tell everyone. Yes, that's the way to go if you want that flexibility. That's what you want to do. But you're going to pay for that every month. So that on top of your Part B premium, you're looking at about close to $400 a month for insurance. So the other thing about those, though, they're guaranteed issue when you turn 65, but after that, you have to go through underwriting. So if you've had any health conditions, anything, take certain medications, heart condition, anything like that, most of the time I won't get you through underwriting. If I do, the premium's going to be very, very expensive. And they age out. They go up every year. So I may write it for you when you first turn 65 for a 160 or 130, but it's going to go up every year. So I had a gentleman from last year that came to me and he's like, Teresa, I just cannot keep paying for this supplement. And I was like, okay, well, let's sit down and look at it. His had gone up and he was paying nearly $700 a month for his supplement. So that's the thing is when I teach these classes and I partner with people, people think they're stuck or they don't know that there's not other options for them. There is. And what I love about being a broker is I don't care which way we get your coverage. Let's just get what's best for you. Because like I said, everybody's situation is different. Their needs are different. You know, if they may need something more specialized for diabetes or something for this, different plans offer different programs. They offer different help. I also help my clients apply for Medicaid. So a lot of seniors don't know that there is a Medicaid by your income designed to help what's called a Medicare savings program that helps with your Part B premium. It helps knock the cost down on your prescriptions. There's a lot of different programs out there that they don't know you can apply for through the state and through Social Security that will help with costs of prescriptions, costs with your Part B, even get your plans down even cheaper, sometimes give you added benefits. Some of them will give you a food card. Some of them will give you, depending on what level of Medicaid we get. Now it's hard, you know, it's hard to do, and the state's made it harder this year for me to get people that program, but it's always something to look at. So I always tell everybody, meet with me one-on-one. You tell me what your circumstances are. It's nobody else's business what that is. And let's see what you're eligible for, because if you're eligible for it, I'm going to help you fight and get it. Another program that's out there through Social Security, it's low-income subsidy. I don't know if any of you may on that or know of it, but it's also on your income. But you can apply for that, and it puts a cap on your prescription copays. You will never pay any more than $12.15 for a Tier 5 drug if you're on LIS. They designed that to help people because of cost of drugs, because as we know, those are very expensive depending if you're a heart patient, a diabetic, you know that those drugs are very expensive. So that's just something to help. The government Medicare did come in 2 years ago and eliminated the donut hole. I don't know if y'all have ever heard of that dirty word, but we're glad that that is gone. So they put a cap on it to $2,100. It was that. It's going to go up again this year. We just got rule from CMS, but that is the thing is that whenever I do this, it's because people a lot of times don't know what is out there and is available. They think what they have is they're stuck. And the one thing I tell everyone is these plans change every year. I start going to rollouts in August with all these different carriers to find out what benefits are you going to cut, are you going to add any, and are you still going to be in the area? So for an example, last year, I partnered with Limestone Medical in Groesbeck as well. And in that area, in Limestone County, they're very limited to what plans are available, but Humana was one of our big ones. I mean, it was one of the best plans. It was a PPO. All the doctors took it. It was a great plan for those people in that area because everything is area specific. Well, they came in and they just dropped their plan, pulled out. Had I not contacted 120 of my clients, they would have went January 1 with no insurance. Because they're supposed to notify them and send it out in the mail. They're supposed to do all the things, but they don't always do that so well. So as a broker with my clients, when I know that those changes are going to happen, I already knew, but I couldn't talk about it till October. But we'd already been to the rollout, and I already knew they were fixing to pull out of there. I was already making preparation to contact my clients and say, listen, we got to meet this year. Your plan's not going to be what's best for you next year. Excuse me. So that's why I tell everyone, when you do a plan, it's just for 1 year. I have so many clients, well, I know I've had this plan forever and I just want to keep it. Well, that's great, but do you know it's not going to cover your medicine next year? So that's the thing is, if you don't look at it and review it every year, you don't know what could be changing, what you could be losing. They send that out, but y'all get all of that stuff in the mail all the time. Are you going to sit down and read all of that? I don't have one client that does ever. They're always like, Teresa, I didn't know. I said, well, they sent you something in the mail. Oh, I probably just threw that away. Yes. I agree, you probably did. So, but that's the thing is everything is for 1 year and circumstances change from year to year. What may be happening this year may not be the same next year. So I always just do a review. I send out postcards to my clients about every August, say, hey, here we go again. Y'all know October 15th, December 7th is enrollment time. Let's sit down and let's take a look. How is everything going? If you're doing great and there's no problems, go right along, but if there is, we need to know so we can sit down, look at it, make an assessment, and see where we can pivot from here to get you through another year. So like this year too, I had some plans, they dropped their dental. I was like, great, I need my clients to be able to have dental. So we had to do some changes there. So every year they're different. We talked about drug formularies. That is the biggest thorn I have. They all of a sudden don't want to cover a drug. And I've got patients on these expensive drugs, and the insurance is like, no, we're going to pay that no more. Well, great. So then I have to help my client get with her doctor. Hey, can you put in an alternate for this because this isn't going to be covered for them next year, and they have to have it. So we got to get something instead of it because insurance isn't going to pay for it. So there's a lot of things there that I can help, I can advise. But the main thing is I tell everyone is don't get stuck in a rut because you think, oh, I've had this forever and this is what I want to do. Because I've been doing this now 7 years, and I have never 1 year where it's just like, oh, everything's great. I don't have to do nothing this year. This is going to be the best year of my life. No, it never has been that way. If anything, more and more every year it becomes more of a challenge. I also help people get insured that are under 65. It was heartbreaking to me this year because of the rate and premium increases. I had people that had to drop. They couldn't even be insured because people can't pay $600, $700 a month for insurance. So there we look for other resources. I'm sorry, you apply for different programs through the different healthcare systems that can help you if you need to be seen. But it's really heartbreaking when you see that the changes that happen and how it impacts the people below, because it does. And seniors, the one great thing is pretty much most of them, they take better care of the Medicare, but there's still a lot of challenges there, as y'all all well know, as it gets harder and harder. But mainly that's what I do. So if you ever have questions, you think you might be on a plan that isn't what's working for you, don't ever think that that's the only time you can change, because the CMS or Medicare does give us special enrollment periods. So sometimes when you think you're stuck, you're not. I might be able to change it anyway. So just call and let me know if you're having a problem. The other thing is, if you're already on a Medicare Advantage plan, from January 1st to March 31st is another enrollment time. So if you didn't make a change before, you can make it then. So a lot of people don't realize that. But a lot of people think, oh, I'm stuck for another year. Not necessarily, because they do give us disaster, what they call special enrollment periods. That when they declare a national disaster, a lot of times that'll trigger a special enrollment period for someone to change their plan. There's a lot of different rules that come in that you wouldn't know, but we know as brokers because that's our business to know. But Like I said, if you ever have questions, call me. You have my card. It's got my office number, my cell phone number. I do events like this pretty often, so I'm out in the field quite a bit. If I don't answer, please leave me a message. I will call you back. And my message says I'll call you back within 24 hours unless I'm sick or out on vacation. That's what will happen. So if you text me, as Sadie knows, I will text you back. So it might not be right away, like I said, but I will get back to you. But anyways, thank you so much for letting me come today, and I hope I can answer any questions you may have. And if you want to meet with me one-on-one, please give me a call. I can set up an appointment time. My office out of Waco. I will also come to you, though. If it's hard for you to come to me, like I said, I'm out in the field. I meet my clients at their homes all the time because I know what the sometimes the hardship it is to try to travel or drive or get somewhere. So I don't have any problem coming to you. So does anybody have any questions for me?
What's the average, like supplements that you have and stuff, you know, goes to the, what's the average that you're paying? Like you said, some people are like 700, you know.
It depends on your company a lot of times. So whenever, and this is the reason I chose to be an independent broker, because I don't work for one person. I'm appointed with every company. So when you sit down to look at quoting and things like that, I can quote you through several different companies. And also, I always look at a company that I know is not going to influx a lot. Because some of them, depending on who they are, Mutual of Omaha is one of our ones. They will bounce up really high every year. They do a big hike. Then I have some that they stay pretty steady, $2 or $3, you know, they won't. But like I said, they age out. So the older you get, the more they're charging you for it. Right now, if you're turning 65, the cheapest I've been able to write with discounts. For a female, I wrote one last week for $130, but for a male, it was $162. For whatever reason, they charge them more. I do everything I can to find discounts. They give household discounts, automatic bank withdrawal discounts, multiple household discounts, anything I can to try to knock the premium down. But that right now, and to tell you the difference, last year, I was writing them for a female, I was writing them for 90 to 98, and for a male, I was writing it for like 120. But the increase went up so much. And so that's what I say, what's good for Joe is not always good for this one here, because some people can't pay that. You're already paying $202.90, and that goes up every year. They raise that every year. So $0 a month and only paying when you need it on an Advantage plan a lot of times becomes somebody's better deal because they can't afford that every month, and they need added benefits. They need dental, they need vision, they need help paying for their glasses, they need that gym membership for their health, they need transportation. These plans offer transportation to help them get back and forth to the doctor, to the pharmacy. Like I said, I work with food banks and housing authorities, and people are in a situation that you just try to do everything you can to get them everything that they need. The other thing is, with those added plans, I work with a lot of physicians, so say you need a surgery, but you got an infection in your mouth. They can't do surgery until you get that fixed. People need a plan to help them get their dental done so they can go have knee surgery done, because they won't touch you until you have that done because of infection. So there's always something that plays into part of what's going on with somebody. I've had people all the time that they're fine with their supplement. They were able to afford it maybe, but they needed these other benefits, and they can't afford adding all of those. You know, because every benefit you add, if you're not with something with it all combined, you're paying another premium. So you start adding all that up, that's a lot of money a month for insurance. So it just always depends, but right now the best price I can get on someone turning 65 for a male has been about $162 with discounts. It was $202 before I got the discounts for him. So it's crazy to me because they just keep going up. But depending on your company, usually is how you're going to see the influx. And some of them, they really jack them up. But I try to stay away from those. I usually won't even quote through them. I'm appointed with them, but I already know what I'm looking at. I'll check it. But if I know it's going to be a big increase for you next year, there's no sense in even messing with it to me, because I want to start you where you're going to be steady. Anybody else?
Discounts for people over 80?
Nope. And I probably couldn't even get you through underwriting with a supplement. But no, there's no discounts there, unfortunately. There should be, but there's not.
I've seen a lot of like patients and you know, friends and stuff that they get cancer and stuff and their insurance covers so much. When you hear on the TV and stuff about actually getting a separate policy,
There is cancer policies.
now, are those really beneficial?
Though, so there again, that's something else that you have to look at. You go through underwriting for them. So, but yes, due to that fact, this is before I even did this, when I was doing the other side of this. After my dad passed away, I helped my mom with all of her stuff. And because I worked, when I first started coding and billing, I worked for cancer. I was in oncology. And I saw that because insurance is only going to go so far. And so you get to a certain point in your treatment, you know, one treatment's at that time, $30,000, $40,000, it starts racking up bills pretty quickly on somebody. So we did have supplement cancer policies that would come in and help pick up some of that. When I saw those, when I was doing billing, I got my mom one, and I was very thankful that I did because she got ovarian cancer. And had we not, we would have had quite a few bills from her surgeries and different things that they did pay. So they can be beneficial, but I do know that you have to, they're age specific, and I've only done a couple of them, but you do have to go through underwriting and the applications a little bit more. So I always tell anybody, if you're looking at something like that, or even long-term care is something that is very beneficial too for people once they get to nursing facilities and things like that. But any plans like that, you need to get quite early, or else you're not going to be able to be approved for them. So that's the sad thing about it. Same with life insurance. I mean, I do that as well. You get to a point where the only thing you're going to be able to be approved for is a final expense, just enough to help for some of the funeral arrangements. And usually it's not very much. And if you've got any type of medical diagnosis of any kind, a lot of high blood pressure, it'll keep you from getting it, or you can get it, but you're going to pay for it. Your premium's going to be very high. So it's just always, I tell everybody, let's do it and see what they tell us, and go from there is really what we have to do. But I do know that I had a gentleman, he had been sick and he was young, didn't think he needed anything done. Well, by that time, I couldn't really get him any life insurance. I was able to get him a final expense, but it was very expensive, but he had to have it. He wanted to protect his kids, so we went ahead with it, but it was, you know, they look at those things, and I can get some companies to approve them, but they're going to pay for it. But it's still better than nothing a lot of times. So, yes, ma'am.
Do you know what Medicare policies pay on like the radiation treatments for cancer?
It depends on who you have. So it would be whatever plan you have. You have United Healthcare? Do you have the Essentials plan, or?
That's my husband, but we're on the same thing, I think.
I'm just trying to find the plan number. Okay, you're on the 052. Ooh, you're on the 052.
What's that? What's that?
Well, they really reduced their plans this year. Let me grab my laptop. So are you talking about his Part B medication? Were they giving him something within the doctor for, was it like an infusion, or is this something?
It hasn't started yet, but it's an oral they want him to take for 1 year. Hormone therapy, anti-testosterone therapy.
So that's falling under your Part D.
And what they told us was that we had to pay the out-of-pocket max, which was,
2,100.
yeah, for the year.
So
The drug was supposed to be $2,000 a month if you didn't have any.
insurance at all.
So I didn't know about
So the testosterone that they're talking about is falling under your drug coverage, which is your Part D. So the reason they're saying $2,100 because that's the maximum out of pocket for Part D. It sounds like that's a tier 5, so you have to pay 20% of the cost of that drug is why you're having to pay so much for it. Radiation would be another option, but I don't know that from what you would have to do, from what radiation will do to you, if that would be better, but let me see what your radiation benefit is. Let me pull your plan up. Oh, let me hotspot.
We had, they just recently changed this United, they dropped it, in our area all of a sudden last year, and then they switched us
Yeah,
to this plan. And
I think are you paying 21? I think that's the $21 plan. Let me look it up. You don't pay anything for that? Okay, let me see which one they put you on. If I can get connected.
not more than what social, they take out social.
I don't know why it says I'm connected. Well, I think it's because we're at this medical building. It's not allowing me to.
Oh, yeah, you have trouble with the internet with this one.
Yeah, it's not. My computer is frozen. But do you have my card? Give me a call, and I can definitely look it up when I can pull the plan up. But the reason why you're paying so much is because the testosterone, the one that they're talking about, is falling under your Part D, and it's probably a tier 5, and so you're paying the maximum on that until you reach your $2,100, and then it'll pay 100%. Radiation therapy is just going to be a copay, but I need to see what it is. But it's every time you go. Generally, radiation therapy, most of the time, you go every day. So that can, then you just kind of weigh your costs and cost versus what the radiation therapy is going to do. Is it for your husband? How that's going to impact him versus the testosterone therapy too.
It's very expensive.
Yeah, so, but also on drugs like that, you can always look at, they have different grant programs and different things through the manufacturers of those drugs that will help for the cost. So it's always something to look at. You can even ask your doctor. A lot of times the doctor has information on things like that. For instance, there's a Eliquis, which is a blood thinner. It was very expensive last year. And we were able to do that, go through the manufacturer and get coupon cards and different things where the people could get it because they could not afford it like that, even though they had insurance. There's programs that will help, but we had to do a lot of paperwork, financial paperwork and different things. But when they see that you really need something, but you can't, even with insurance, you can't afford it. There are things out there that but you have to ask them. But that's something that I help people look for because it happens a lot. The year before that, it was Mounjaro and Tresiba and some of these other very expensive drugs that you hear about, Jardiance. Even though you've got insurance, when you're hitting a tier 5 drug, that copay is a lot. Luckily, like I said, $2,100 is still a lot, but at least you don't have the donut hole anymore because it used to go up to $7,500 if you went to a catastrophic phase. So at least they capped that, which doesn't change the fact that that is still a lot of money, I guarantee it, but at least they got it to there because it used to be way worse. But I would just weigh your options and talk to your doctor. It's going to be a copay. If you did radiation, I'd have to find out what your copay is. I don't want to say because I want to see the plan, and I can't memorize every one, but whatever that copay is, but it'll be a daily copay. So that's what you're looking at versus the price on that medicine. And depending on how long, usually radiation, they tell you 2 weeks or a week or
6 to 9.
yeah. So you may be looking about the same, possibly, after you add up the copays, the time he's doing it. So then that's kind of where you'll be. So I would definitely ask them on that other drug if there is any type of programs or anything that help with cost of it. Because they're not going to tell you unless you ask, but a lot of times nurses or your doctor's office, if they're used to, it's just the oncologist that's telling you that, it's oncology. Who is it? Who's his oncologist? You got Texas Oncology? Scott and White. Scott and White has programs within them too that you need to look into. And also, do you use Scott and White primarily? Scott and White has their own health plan, and that for me has been better than United. Most of my people that were in United, I moved to that. And if you're already using Scott and White, having their health plan and using their facility, it's going to work with you more too. So, and we are in a special enrollment period. If you do need to make changes because of everything he's got going on, let me know. I can help with that. But I do know that.
But I couldn't change it till next year.
No, we could change it now because I have a special enrollment period. If you wanted to do that, I could have him effective in Scott and White May 1st. So yeah, so there is a change I can make right now. I just changed one yesterday, but that's something I partner with Scott and White. So you'll see me, I work at the hospital here in Waco every Thursday. I'm in Temple every Wednesday. But from what I've done and what I've seen, especially with all the changes, like your plan dropped with United out here, I'm not sure what plan that is, but I don't know if it's the best one, and your copays may be higher. That's why I was hoping I could pull it up, because there's one out here that's, I wouldn't write it because of the copays. But a lot of times if you are already seeing Scott and White and you've got something going on like you're going on, they have financial assistance, they work with their health plan, everything and you will get away from all your referrals and all the stuff you're having to deal with now too. And if you're going through what you're fixing to go through, you don't need all that headache too. Just gonna say. And with Scott and White, you do not have referrals. You don't have to mess with any of that stuff. You don't have to pick a primary care. You don't have to do any of those hoops that United makes you do. So it's something to consider. Talk to your husband about it. But yes, we can make a change if y'all want to.
What do you pay monthly?
$0.
Scott and White, you pay monthly $0?
Uh-huh.
Ed had his, I didn't have to pay anything, not for his chemo, not for radiation.
Yeah.
I didn't have to pay anything.
They've got better dental. They've got their benefits. You get $80 a quarter for OTC. I mean, it's just a better all around. Like I said, I don't care who my clients are, and United used to be one of my biggest contenders, but this year I've just had a lot of mine that I've had to move just because of things like that. And if they're already going to Scott and White anyway, it's Scott and White Central Texas, but their plan just held steady. They didn't drop a lot of things this year. They enhanced things more. But it's something to consider, especially with everything you're fixing to go through. But if you don't, I have another one here. But yeah, so we can make changes this time of year because I just looked this morning and they did give us a national disaster. So I do have one in here that I can change on if people need to. But we'd have to look at it. But y'all are McLennan County, right?
Yes.
Yeah. So yeah, we're good to go. But yeah, so that's the thing. Like there was a perfect example. Things change in your life that can make everything different with your insurance plan. And you know, they've been fine with that all this time, but now we've got something that we got to deal with. So that's why I say always do a review. You may not change anything. And this is the thing I want everyone to know too. If it is not in your best interest, I'm going to tell you and I'm not going to do it because I'm a Christian first and I sleep at night. So if it is not what someone needs to do, I'm not that person that's going to do it. And I will tell you that. If you tell me, no, this is what I want to do, I'll do what you ask me to do. Yes. But if it is not in your best interest, I'm going to tell you that. And if that means I don't gain you as a client, that's okay, because you're going to know that about me and you'll still bless me because you'll send me to somebody else that I can help. So always know that if it isn't right for you, I won't do it. That's just not my message. When you hear, if you call me, it'll say, I'm here to be a blessing and a resource, and that is it. So if I can't do that, then I've not done my job. But working with this and being in this industry as long as I have, I've seen where people do what's not right for somebody. And I'm not going to be that person. And I don't think it's right. I see people do it to my clients every day because they don't understand. You know, they'll phone, they'll do things. not realizing that what they just did was detrimental to that person, and they don't care. So that is something that we're a very small brokerage, and that is who we are, and we're just not going to do it. So if people do that, then, you know, I feel sorry for them because I don't need it that bad. But like I said, you know, both my parents are gone now. I helped them, but I remember after my dad died, some people trying to blow the snow over my mom, and here she was, and Daddy had always handled everything, and I was like, Mom. And some people don't have that person. You wouldn't believe the people I have that have nobody. I mean, I go see people, that's why I say I'll come to you, because I have so many people that if I didn't, nobody would go help them. And it's just sad to me. So that's the reason why I started working, and when she asked me to come do this, this is what I love to do. Get out in the community, especially the smaller communities, because so many people don't know that there's help out there. And there is. There's something, and I may not be able to, I'm not a miracle worker, but if there's something we can find to help you, I'll help you find it. So that's one thing I love about having the knowledge of working on the other side of things, because I did get that knowledge of billing and coding and let me see your bill. Nope, they did not charge you right. You know, things like that. So that's an extra service I do provide to my clients because I have the knowledge to do that. Because otherwise they just wouldn't know. So just always know that even if you're not my client, I will still answer questions. I will still help you. I'm not that person that's like, hey, I'm not going to answer that. That's not me. So, because like I said, you'll send me somebody I can help, but I'll still help you too, because that's just what I do. And I know that you may not have that person to ask that question to, and I'm going to be honest with you when you do ask me. So, it's very nice being here today. Does anybody have any more questions or?
Just a comment with regard to medication, especially if there's a lot of changes taking place. At first, ask for samples
Yeah.
at the doctor's office, and then ask about generic, and then ask about prescription assistance plans.
Right. Yeah, and that's why LIS and all those different things. But I will tell you something that I found this year, and it's the craziest thing I've ever, and just ran it yesterday. Used to, if you got a generic, you knew it was going to be cheaper, right? Not anymore. Yesterday, a gentleman was taking Xarelto, and Xarelto is expensive. And he said, I said, well, let me just run the generic and just see. The generic wasn't even covered. So they would cover the name brand one, but won't even cover the generic. The generic was going to be like $12,000 a year for him. I was like, whoa. So that's why I always tell everyone, even whenever you're getting ready every year during enrollment time, let's at least run your medicine still, because it changes.
That booklet that they send you.
Yeah.
And know what the tiers are. That's the thing to know, is what tier.
Yeah, and because they changed those. Like this year, what used to be a tier 1 and 2 went to tier 3 and 4. And that's why you're getting, and people are calling me and saying, oh, now I have a copay. I've never had to pay for this. Another thing to always know on your medicine, mail order is usually your best way to do it. I know some people are scared of it, but you always get it cheaper if you go through mail order. It's just going to be cheaper than going to a retail pharmacy. And stay away from CVS on most all plans, because CVS is high. Yeah. So they're an in-network, but they're not preferred, and they're always higher for whatever reason, and Walgreens too. H-E-B, Walmart, if you want to go retail, is usually the cheaper ones. But if you're on maintenance medications that you're getting every month, it's best if you can just get your mail order set up and let it come to you, and you're going to save money. They usually will work with you on billing. And I don't know if anyone knows this, and something for you if you do decide to go the testosterone route, and I can help you with if we talk. You can do a payment plan program through the insurance company that you pay them a monthly fee where you're not hit with that big price every month. And they will pay your bill, and then you just pay them monthly to break it down so that you can afford it. And so I can help you do that too and show you how to set it up and what to do with it. But that is something that they did offer starting last year to help with those things right there. So if we decide to meet, that's something we can discuss, and I help my clients do it. I'll show you exactly what to do to get it set up. It's very simple, and everybody that I've had to have do it, it's worked out very well for them. So that's something to always know. Don't ever think that there's not something out there that can't help you, because there is. But that's one thing, and I just now thought of that just thinking, but if you decide to go that route, it may be easier on your husband, number one, and two, you may be able to spread it out to where it's easier for y'all completely, that we can do. And I'll show you how to set it up. So, if you'll excuse me, my husband is worried about me. I forgot to tell him I was here today. I'm in trouble.
Does the phone work?
I don't think so. I may have to step out. I just saw he come across my watch, question mark. And I was like, uh-oh, I'm in trouble. Yeah. Do y'all have any more questions, or?
I've been thinking about, I'm on Blue Cross Blue Shield, and I've been thinking about changing to Scott and White.
Uh-huh.
All my doctors are Scott and White except one, two, actually. But, it just, I don't know. It just seems like it would work out better for me.
Well, you have my card. Call me. We'll sit down. We'll look at what you have, go over all of that, and I'll show you the differences, and then you can decide what you think's best for you.
Well, they go up every year
Yes,
so much.
and they will probably continue to do that.
Yeah, and then I have one medication that's $378, and another one that's I don't use all the time, but when I need it, I have to get a prescription for it. But it's like 100 something too.
Yeah, your drug plan is probably not covering your formulary very well this year either, because you're on a standalone and you've got a $615 deductible. That's what it sounds like. So,
No, I've been paying it.
I know, because you're paying that. Yes. Give me a call. We'll sit down, and what we'll do is I'll look at all your medicine. We'll look at all your doctors. We'll look at what your coverage currently is and what you could do if you did something different, and then you just let me know, and we can go from there. Okay? But give me a call, and like I said, even if they allow, I'll come meet you here, like whatever, your home, whatever you need me to do.
When the Scott and White, they let you see a doctor outside of Scott and White, because I'm got one.
And that's something I would check before we even pursued anything. We would look at all your doctors and make sure everything would work with what we went to, so that anything you did would not change anything with your health. Okay? So if it would, I would tell you, we can't because XYZ. But if it would work and your doctors worked and your medicine worked, then we'd look at it and then you just decide.
Thank you so
Thank
much.
you.